How does partial nephrectomy affect daily life and recovery? How does partial nephrectomy affect daily life and recovery? This is an important question for anyone facing kidney cancer treatment. Partial nephrectomy is a surgical procedure that removes part of the kidney, often to treat kidney cancer. Understanding the impact of this surgery on daily life and recovery can help patients prepare for what lies ahead. Recovery times can vary based on the surgical approach and individual factors. Most patients can return to their normal daily activities within 4 to 12 weeks after surgery. If the surgery is minimally invasive, like robotic or laparoscopic techniques, recovery can be quicker, often allowing a return to normal activities in about 2 to 6 weeks. However, open surgery usually requires a longer recovery period, typically around 8 to 12 weeks. Returning to work also depends on the physical demands of the job. For those with less physically demanding roles, work may be resumed as early as 2 to 4 weeks after surgery. More strenuous jobs may require additional time off to ensure proper healing. Patients are generally advised to avoid heavy lifting, strenuous exercise, and resistance training for weeks post-surgery. After the operation, some physical symptoms are common. Patients may experience pain and soreness in the abdominal or flank area, which usually lasts 1 to 2 weeks. Pain management typically involves prescribed medications, starting with narcotics and transitioning to non-steroidal anti-inflammatory drugs as needed. Other temporary symptoms can include constipation, nausea, or fatigue, but energy levels usually improve gradually over several weeks to months. During recovery, some patients may have temporary devices like drainage tubes or catheters, which are usually removed within days after surgery. The goal of partial nephrectomy is to preserve as much kidney function as possible by removing only the tumor and a small margin of healthy tissue. This approach helps maintain overall kidney function and reduces the risk of chronic kidney disease compared to a full nephrectomy, where the entire kidney is removed. Most patients see their kidney function return to near normal levels within 6 to 12 weeks after surgery. However, some may experience minimal changes in blood markers like creatinine and blood urea nitrogen. Engaging in physical activity before and after surgery, known as prehabilitation, can help speed up recovery and improve overall outcomes. Follow-up appointments are crucial for monitoring wound healing, kidney function, and checking for any recurrence of cancer. Imaging tests, such as computed tomography scans, are commonly performed at 1 month, 12 months, and 24 months after surgery. Patients should also report any abnormal symptoms, such as fever, severe pain, or signs of infection, to their healthcare provider promptly. In terms of daily life, most patients experience a gradual return to their usual activities, including work, exercise, and family time, within weeks to a few months. Early mobilization, like walking multiple times a day soon after surgery, is encouraged to reduce the risk of complications such as blood clots and pneumonia. Emotional and psychological recovery is also important, and patients may benefit from support and counseling as they adjust to changes after cancer treatment. In summary, partial nephrectomy generally allows patients to maintain good kidney function and return to normal daily life within weeks to a few months. Recovery times are shorter for minimally invasive surgery, and while pain and fatigue are expected, they are manageable. Careful follow-up ensures ongoing kidney health and cancer surveillance. Individual recovery experiences will vary, so personalized medical advice and support are essential throughout the process.